Hey everyone. So let's talk about back pain. I know it's something a ton of us deal with. But what if the reason for that ache isn't what you think it is? Today, we are going to dive into some really fascinating new research that points to a surprising hidden cause for some of that nagging pain. These things called spinal cysts.
Right? We always blame it on, sleeping funny or lifting a box the wrong way. But just for a second, what if your back pain is more than a simple muscle strain? What if there's something else going on in there, something tiny, but powerful enough to cause a whole lot of trouble? Okay, before we jump in, a really quick but important heads up. The study we're digging into today is a preprint. Now, all that means is that it's super fresh research that hasn't gone through the whole formal peer review process just yet. So we should think of this as a sneak peek, an early look at some new ideas, not necessarily the final settled science. All right, so let's get into it. We're starting with a super common problem, back pain. But we're looking at it through the lens of a pretty uncommon cause, a little thing called a spinal synovial cyst. So what on earth is that? Well, picture a little sac filled with fluid. You might have even heard of them in other joints, like your hands or knees, where they're way more common. But when one of these pops up in the super crowded real estate of your spine, it can cause some pretty serious symptoms, even though it's pretty rare to find one there. So let's get a little more specific and talk about the anatomy of what's also called a facet cyst. Where do they come from? What are they really? Basically, a synovial cyst is just a little pouch of joint fluid that kind of pushes its way out from the lining of a joint. Honestly, the best way to picture it is like a blister, but one that forms on the inside of that joint. And it turns out they have a favorite place to show up in the spine. The huge majority, we're talking over half of all cases, are found in the lower back, right at the L4, L5 level. The other common spots are right above and right below that. And it makes sense because this is the part of your spine that's doing a ton of work, a lot of moving and bending. Which brings us to the next logical question. So why do they happen? Well, it's not just random. The research shows that the main culprit is degenerative changes, and that's just a fancy way of saying the natural wear and tear our spines go through over time, which can lead to a bit of instability in the joints. Now, you're probably picturing something massive, right? But get this, the average size of the cysts they found in this study was only about 6.5 by 6 millimeters. That's smaller than a pea. It just goes to show you, in a tight space like the spinal canal, even something that tiny can cause some major problems. Okay, so if they're this small and they're hidden deep inside the spine, how in the world do doctors even find them? Let's walk through how they do it. The number one tool for the job is an MRI. It is absolutely the gold standard. And that's because it gives this incredibly detailed picture of soft tissues. It lets doctors see the cyst, measure it, and see exactly which nerves it might be pressing on. And this is a great breakdown of why a doctor might want more than one kind of picture. The MRI is the star of the show for looking at the soft stuff, like the cyst itself. But a CT scan, that's way better for looking at the bones, which helps them see how the cyst is attached or if any part of it has hardened. Okay, so the doctor finds a cyst, now what? Well, it turns out there are two main roads you can go down for treatment. Path number one is what they call conservative care. This is basically the let's try everything else before surgery approach. It includes the stuff you'd probably expect, some rest, pain relievers, physical therapy, and they usually give this about 6 to 8 weeks to see if it makes a difference. But if that doesn't do the trick, or if things are actually getting worse, then it's time to talk about path number two, surgery. This means going in and dealing with the problem head-on. That could mean anything from just relieving the pressure on the nerve to taking the whole cyst out, and sometimes even fusing the bones to stabilize the area. So, this brings us to the really interesting part. What did this study of 24 patients actually find? How well did these two different paths work out for them? First, let's look at who these patients were. And right away, something jumps out. Of the 24 people in the study, a whopping 75% of them were women. That's a pretty significant 3-to-1 ratio. And look at the average age, 58. This lines up perfectly with what we were just talking about. The idea that these cysts are often tied to that long-term wear and tear that happens as our spines get a little older. Now, here is another really key finding. A full 3/4 of these patients didn't just have a cyst, they also had something called spinal stenosis, which is a narrowing of the spinal canal. It tells us these two problems often show up together, which can really double down on the pressure being put on those nerves.
So, how did the group split up when it came to treatment? Well, you can see here that most of them, 14 patients, went down that conservative care path first, while the other 10 ended up having surgery. And here we go. This is really the heart of the study's findings. On the conservative path, more than half of the patients, about 58%, got better. That's pretty good. But look at the surgical path. Every single patient who had surgery, 100% of them had what the study called good or excellent results. That's a huge difference. And what's more, it seems like the fix was a lasting one. The researchers followed up with the surgery patients for, on average, more than 2 years. And in all that time, none of the cysts came back, and they didn't have any new issues with instability. So for them, it was a really durable solution. So all of this leaves us with a really interesting final thought. We've seen that the non-surgical path can absolutely work for a lot of people, but we've also seen that surgery can be incredibly successful for others. So maybe the real key here isn't about which treatment is better overall, but about finding the exact right treatment for the right person at the right time. It's a great little window into how personal healthcare really has to be.